This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Hip pain is something that can affect anyone at any age, whether it's something you're born with or the result of an injury. Mercy Health specializes in hip preservation surgery that's less invasive than a replacement, and you can get back to doing what you love to do sooner than you might think.
Hey, my name is Bansal. I'm one of the orthopedic surgeons who do mainly joint replacement, hip and knee and shoulder replacements with hip preservation, or trying to save your joint. Hip pain can present itself. A lot of times people have a hard time getting in and out of their car. They have a hard time putting on their sock or tying their shoe. If it's the right side, many folks drive on cruise control because they can't drive for long periods of time with their foot in a specific position. So they'd have trouble walking. They'd have trouble getting up and down stairs, going up and down hills. They feel that they're limping a lot. They usually favor the side that's the one that's hurting the most. There's really two elements. You can either have something traumatic that happened to you or something that's been lingering for a while. So this is the question of nature versus nurture. Were you designed to be a certain way your whole life, or genetically inclined to have some pain at some point in your life? Or is it some degree of activity that gets you there? There's some repetitive trauma that you get throughout your life that can then degrade your joint over time. And that could be true for young folks, and that could be true for middle-aged or older folks, and it could be present at all ages. The best analogy is really that of a ball bearing. So if you have a metal ball bearing, if you have a little kink in the ball bearing, you can smooth out the kink and move on, and it functions like new, or almost like new. If because of the kinks it's become a rusty bearing, like there's rust that's developed on top of the metal or whatever type of metal that exists in the bearing, then you have to take the bearing out and put a new one in. So it really comes down to the surface of the cartilage. If the cartilage, which is the smooth Teflon coating at the end of the bone, if that's no longer good, and now I call it a rusty ball bearing, then you got to take it out and put a new one in. That again is true for people who are in their 30s. It's true in the 50s and beyond. Of course, it's most common in people in their 60s and older, but it's being done more and more commonly at younger ages. If they're a high impact athlete, we want to try and preserve it as much as possible. So that's one thing. The second thing is how bad their cartilage is. If it's too late, if the bearing is already rusty, then no matter how active you are, you have to replace it. The vast majority of operations are done through camera incisions. Actually, they're all just minimally invasive. They're 1 centimeter scars. What we can do is you can go inside, we open the capsule open, which is really the sacred, bag of fluid casing that the hip joint lives in, and we smooth out the bump. We smooth out the bump on the ball, we smooth out the bump on the socket, we repair the labrum, and it has a lot of nerve endings. So when you tear it, you have some pain. You'll know when you tear that. Now, not every labrum which has a tear in it needs to be repaired. So that's the one thing you should know as well. It does not need to be repaired. But if we are in the operation and it's hurting a lot for a while, we do repair that at that time. To regain their full mobility and function, it typically takes about 2 to 3 months. The first 2 weeks you're on crutches, and beyond that you start to ramp up, do a therapy protocol, and most people are better by 2 and over 90% better by 3 months. Folks that are just going to work and back, depending on their level of activity, they can go back at 6 weeks. More sedentary jobs can go back at 2 weeks. For some of our higher level athletes, like professional athletes that we treat, or semi-professional athletes, collegiate level athletes, and everyone in between, we have a 6-month recovery to sort of high intense return to sport. They can typically start inline running at 3 months following a hip preservation operation, and then by 6 months they can do usually anything. We are not as good as God at creating the hip by any means, but our technology and medical sciences has come close as possible. Just in the last 5 years, our understanding of hip preservation has skyrocketed in the last 5 to 10 years. So just because you're seeking help doesn't mean we're telling you that you have to have something done. First objective is clearly conservative. So the hip is reasonable to treat, and it's within our realm of possibility to treat. One of the greatest benefits that you could do for your hip is do some hamstring yoga treatment. If you look up some yoga videos that'll work on your hip flexor, your gluteus, and your hamstring stretching, it'll stretch out your core, it'll stretch out your back. As long as you're keeping active and staying more mobile, you'll stay out of sight for us, which is the goal. If you'd like to schedule a consultation, please call us 513-347-9999, or you can visit our website mercy.com/Cincinnati.